Hello, good morning, ICU. Okay, a crash. The patient still has a heartbeat. Okay, we're coming up now, 421, right? Okay, Sarah, grab the crash box. Michelle, grab the drugs. Let's go, crash 421 now.
Welcome to the Intensive Care Unit of Port of Spain General Hospital. We understand that this is probably a difficult time for you and your family. Apart from the emotional stress, the amount of new information you have to process can be overwhelming. It is our hope that this video will help to orient you to these unfamiliar things you might see or hear in the ICU so that you might get a better understanding of what is happening to your relative. ICU care involves the use of several types of equipment and tools. Here are a few of them you might see. Next to every bed is a ventilator or breathing machine. Some patients need help breathing because either their lungs are not functioning as they should or because they are not conscious or awake enough to breathe efficiently on their own. This machine pushes oxygen through a tube that is connected to a patient's lungs and therefore breathes for the patient. The machine can actually be set to do all the breathing, or it can give the patient some breaths while allowing him to take some on his own. Alternatively, it can allow a patient to take all the breaths for himself with just a little help. You can ask the doctors which setting your relative is on and why your relative actually needed help with respect to breathing. Another item you may see are these infusion pumps. They provide a constant stream of fluids and medications into the patient. Quite often, the medications given through these pumps fall into three main categories or groups. The first category is drugs that keep the patient asleep or sedated. These help to keep the patient comfortable as well as help the brain to rest. The second category is strong painkillers such as morphine. These also help to keep the patient comfortable. The third category is drugs that keep the patient's blood pressure up by either making the heart pump better or by making the blood vessels tighter. It is very common for all three types of drugs to be used at the same time. ICU doctors will let you know which ones we are using for your relative. Continuous moment-by-moment monitoring of patients in ICU is of critical importance. Here are a few things you will see on your relative that help to give us the information we need in order to treat them. You might see some tubing like this at your relative's neck or just below the collarbone. It is called a CVP line. This line goes into a large vein and the tip of it sits at the entrance to the heart. Do not worry, the spot where this enters the body was made numb before we put it in, so it did not hurt the patient while it was being placed. This line has several ports through which drugs and fluids can be given. The pressure in the vein can also be measured through this line and tell us if the patient needs more fluid in their blood vessels, has enough fluid, or has an excess of fluids. Depending on the situation, the doctors will treat a patient based on that information. On your relative's hand or foot, there will also be a line that is in an artery. This too did not hurt while being placed. This line measures the blood pressure on a second-to-second basis. You can see the measurement here on the bedside monitor in red. Blood samples can also be taken pain-free from this line for lab analysis. On the chest of a patient, you will see some stickers with wires attached. These help us to monitor the activity or movement of the heart. You may already know it as an ECG. From your relative's nose or mouth, you may see a plastic tube that looks like this. This nasogastric or stomach tube is used by nurses to feed the patient or, in some cases, to empty the stomach. On the side of the bed, you will see a bag with collected urine. This is connected to a tube that is in the patient's bladder. Monitoring of the urine produced over the entire day helps us to make sure the kidneys are functioning well and that the patient had enough fluids. There may be other pieces of equipment and tubing that may be around your relatives that are not covered in this video. Ask the doctors to explain what these are if you have any questions about them.
I'm the ICU consultant this week. One of the team of doctors who will be dealing with your relative, and we just wanted to bring you in here today to discuss the overall management plan and to kind of get your expectations of what you think has happened or what will happen from now on, and this will be one of the many interviews that we'll be doing.
Listening to information concerning your relative's condition can be overwhelming. We will try our best to communicate effectively with you. It may help, however, if you simplify the information you get into 3 subheadings. The 3 questions you might want answers for are: 1. What is a diagnosis or medical problem affecting my relative? 2. What treatment is being given to fix the problem? And 3. What outcome should I expect? Those 3 areas again are: what is a diagnosis or medical problem? What treatment is being given to solve the problem? And what outcome should I expect? You can use this structure as a guide to know what questions to ask doctors. Thank you for watching. We hope that this video helped to familiarize you with our ICU and helped to make you feel more comfortable when visiting your relative. We invite you to ask any questions that you may have about patient care. Our team of dedicated doctors and nurses are working around the clock to ensure that only the best is given to your relative. Please feel free to watch this video again if you would like to recap either here or online at www.youtube.com. Search ICU Introduction for relatives.